And in this video, I thought that I would share a little bit about like how do I know if I have mast cell activation disorder and the symptoms and what it feels like to have mast cell activation disorder. This one for me, I personally feel is the scariest and it is the hardest to deal with. It causes a lot of just anxiety. It causes a lot of disruption to just daily routines and functioning and all of that. So some of the symptoms of mast cell activation disorder overlap with symptoms of postural orthostatic tachycardia syndrome. So things like an increase in your heart rate, a drop in your blood pressure, heart palpitations, fatigue, brain fog, headaches, digestive system issues, alternating to diarrhea. All of those can be symptoms of mast cell intolerance or mast cell activation disorder, and your body's way of responding to histamine or an allergen threat within your system. And so it can be very hard to understand what to try to manage when you experience those symptoms, because if you have both POTS and mast cell, it can be hard to know, like, am I having a reaction to something, or is this like a POTS flare up? So for me, I started off recognizing that I had some sort of a allergy issue, I would say in 2020. So I can go even further back, I guess, and just talk a little bit about like my childhood. For the most part, I did not experience any sort of allergies when I was a kid. I ate not a very good diet. I had a lot of like artificial food coloring. I ate a lot of the typical like 90s snacks like Gushers and fruit by the foot. And I basically survived off of frozen dinners. So I ate a lot of banquet meals when I was growing up, a lot of processed foods. Um, I did drink Kool-Aid. I wasn't a huge Kool-Aid drinker, but I did drink like with the artificial coloring and everything. Gatorade, soda, Surge. I remember that was a big one. And a lot of food that had like yellow number 5, yellow number 6 in it never seemed to really have an issue necessarily with like hives or any sort of obvious reactions. I did have hyperactivity. I did have symptoms of ADHD. I was a very energetic kid, especially. I was just always bouncing off the walls, full of energy. Unless I was around people, then I was pretty, especially people that I didn't really know, then I was kind of more withdrawn. Um, but when I was in like my comfort zone, I was very much very active and very energetic. I do remember having one instance when I was younger. I would say I was probably maybe in like fourth or fifth grade. Um, and I'm not really sure exactly what happened around this time. I had marshmallows in my room. It was around Easter, and I had one on like the ledge by my window. And I remember being fascinated because ants came in to eat the marshmallow, but I saw like a little black speck on the marshmallow, and I kind of like blew at it, I think, and all of a sudden ants just started just coming out of this marshmallow, and I was like, oh my gosh, that is not good. Um, but I was sleeping right next to it, so it was hard to determine if what kind of a reaction I was having was from like ant bites or something else around that time. But I had a cat as well, named Annie, and she was just the love of my life. And so I would go often outside with her and adventuring with her. And she was very much an outdoors cat and spent like all of her time outdoors almost. And one of the days that I went to go and find her and look for her, she was in some bushes somewhere. And I needed to go and get her from the bushes. Usually she would like come to you if you would call her, but for some reason she was kind of like in these bushes, like she needed you to go get her. So I went through the bushes and I grabbed her and I brought her home. And I would say about a day later, I had a rash of some kind on my legs. And it wasn't necessarily hives. I remember it being some kind of a strange, like, rash. And so I had to go to the doctors. I got some kind of like antibiotic. Couldn't swallow them, so I had to like open them and sprinkle them on applesauce, I remember, and eat it that way. But that was one reaction that I can remember having. My mom said that one of my aunts had claimed that I was allergic to strawberries when I was younger. And I don't know how that determination was made. I don't know if it was because I had hives or something like that, but I remember eating strawberries often and not really feeling, any sort of symptoms. I went through my life mostly without having any sort of reactions to anything. When I was in I would say my early 20s, I had a surgery done and I was prescribed pain medication afterwards. I noticed that when I took it, I had hives. So that was one thing that I noticed I experienced like a reaction to. The same thing happened after I had my wisdom teeth out and I was also prescribed pain medication. And it wasn't like a severe reaction where like I felt like my throat was closing or anything. I just noticed that there were hives. Um, so those were reactions that I had noticed from medications. I never really had a reaction to like antibiotics or anything like that. I then went, throughout my life without really any sort of reactions that I remember until around 2020. So right around 2020, 4 months prior to this, so it was June of 2020. So somewhere around February of 2020, I got sick, and it wasn't COVID or anything like that. It was like a flu kind of illness, but I had a lot of sensory issues and wouldn't let them swab my nose to find out what kind it was exactly. But I had, I got a little bit distracted and I had to go put my bird away. So I am back and I'm a little bit lost. But I think that what I was saying was somewhere around like 2019, I had some kind of like a flu-like illness. That year the flu was really bad. And I remember the symptoms that I had were very severe. I could barely move. I could barely get out of bed. I had a lot of coughing, nose running. I had to pretty much like crawl to the bathroom because it was so hard for me to even move. And I lost my taste and my smell for like 3 days. And then recovered. But prior to that illness, prior to getting sick with like the flu, that same year, a few months before, I had the strangest season with like viral infections in terms of like colds and things like that. So I had 3 colds total. I had one that was somewhat um, mild. So it was just like body aches, a little bit of like coughing, and then that went away. And then I had a very severe cold, probably the worst cold I think I've ever had in my life. And my head felt like it was going to explode. So I had that going on. And then I had just a lingering, like small cold after that. And then a couple months later is when I got the flu. So it was about 4 months after this had passed, after those sicknesses had passed, that I started to really have mast cell issues. So the first experience that I had, I was um, I woke up one day and I noticed that I was itchy and I had hives. Um, they weren't really severe, they were kind of mild. So I went for a walk to the um, pharmacy, like right down the street, and I picked up some hydrocortisone cream and I used that, and that helped a little bit. And then a few days later, I had hives like pretty much head to toe, just covered in hives, just everywhere. And not only that, but I felt really out, like just kind of out of the ordinary, very weird. My head felt funny, like um, nothing that I could really describe. And it was like brain fog. And it was not a headache, but it was like hurting, like a pressure in my head area. And so I couldn't figure out, what was going on with me really. My daughter has allergies, so she has allergies to peanuts, dust mites, and cats. And I've seen pretty severe reactions from her with peanuts. And so I thought, this is it. Like, I went my whole life without really having a severe allergy, and now I must have one to something. Um, and kind of feeling like maybe it was like some sort of a genetic type of thing. I also have family members within my maternal side of the family who have struggled with allergies really bad. So it felt to me like there was some kind of a genetic component going on. But I had no idea what could have triggered it for me. I started to research, what could cause this, like what might be happening. And I discovered like histamine can make it worse. So then I looked at like foods high in histamine and I realized I was eating a lot of foods that were high in histamine. I was eating canned olives, canned tuna, spinach, strawberries on a regular basis, like pretty much daily. And so I went to the urgent care to try to figure out, what could be causing it, like what was going on. And they just said, if it happens again, you might have to have like a steroid to help to manage it and get it under control. But for right now, you can go try to take some Claritin. Um, so I decided at that point that I was going to try a low histamine diet and switch over my diet to like a low histamine kind of protocol. I will kind of attach some pictures in here to different flare-ups that I've had of my mast cell issues and what they've looked like and what they've caused from like different foods that I tried to incorporate into my diet to like symptoms of like my heart rate and my temperature dysregulation and all of that. So I will kind of add that in here. I can't really remember where I was, but I tried to switch to a low histamine diet and eat low histamine foods. Still have carbs, so I did like gluten free as well, but I had like gluten free donuts, gluten free pasta. I was eating vegetables that were low histamine but high in oxalates, not realizing that I was sensitive to the oxalates as well. But overall, I was just trying to modify my diet so that I could have some kind of like relief and figure out what was going on with me in terms of like allergies and stuff like that. Um, I ended up going to the emergency room around that time because I felt almost like my potassium was low. It had been low in the past, and so I kind of felt like that, like I was starting to not be able to walk. And so I went in there and they ran some labs. My electrolytes looked normal, but I had a lot of ketones in my urine. So they told me to go to my primary doctor for like a follow up. For the next 3.5 weeks, I basically had to go everywhere in a wheelchair because I wasn't able to walk. My legs were just completely not functioning. So I couldn't figure out what the heck was wrong. They ran a bunch of labs. When I went to my primary doctor, he referred me over to neurology, and they ran labs checking for like autoimmune issues and all kinds of conditions. My reflexes were hyper reflexive, like overly active. My left side of my body was weaker than my right, but there wasn't anything that they could necessarily say was wrong. Um, my labs came back normal, except I had GAD65 antibodies, which is linked to things like pernicious anemia and type 1 diabetes. But my doctor wasn't concerned at all that I had type 1 diabetes or anything like that. So he just basically said, sometimes people have those antibodies and it doesn't mean anything. And I was like, well, yeah, I can see that. But if somebody has symptoms that are, that they're feeling this way, obviously something's going on, but they couldn't figure it out. So it took me 3.5 weeks exactly to recover from that and to be able to somewhat function normally and to be able to walk normally again. And it was um, just really hard. It felt like my muscles just were fatigued and it was really difficult for me. And then from that point on, had just random mast cell issues. So I would have flare ups where I would be triggered by things and like I would eat a food and shortly after I would get like hives by my eyes. Could not figure out, what exactly was causing it. But the more that I noticed them happening, the more that I could kind of pinpoint certain things in certain foods. I noticed that it happened more often after I ate foods like mustard, um, things that were like jerky, beef jerky, or salami, or meats that were like cured, I think, or like nitrates and things like that. I tend to react to those pretty significantly, like pepperoni, that kind of stuff. Um, Pickles, which was very sad for me because I love pickles, but pickles, especially if the pickles had yellow number 5 in it. So then I started to get kind of curious, with the yellow number 5, because I noticed that when I would eat foods that had that food coloring in it, I was more symptomatic. Um, so at first it was just kind of, I would say, more on the milder end, where I just was getting like hives every once in a while when I would eat certain foods. And as the years rolled on and kind of progressed, that got worse and worse and worse. And it progressed from like hives by the eyes to really short of breath, like hard for me to catch my breath, throat tightness, feeling like my throat was tight or swollen, canker sores in my mouth after I would eat certain foods. It was interesting because arugula is a low histamine food, but for me, when I eat arugula, I get canker sores all over my mouth. I sometimes will get like huge canker sores on like my tongue when I have arugula. My daughter's allergist was like, that's an arugula allergy. Like, you cannot eat arugula. But I would keep trying it because it was just so hard for me to believe that I could be allergic to that. I developed really sensitive gums that were inflamed. I tried to use Sensodyne toothpaste, which made my tongue swell, and particularly stannose fluoride. So I noticed I was able to catch on to that one because I noticed when I would use that particular toothpaste and Sensodyne, and then also I think it was Colgate Total, maybe, the same reaction was happening to me. And I was like, what is going on here? And the main ingredient in both of those was the same. And as soon as I stopped using it, it went away. So that was an allergy for me. I started to have reactions to things like air fresheners where I never did before. I never was really that sensitive to like perfumes and smells and fragrances, but all of a sudden it started to be just unbearable for me. I had plugged in, I typically would get the Airwick air fresheners for my home, and I know they weren't good necessarily, but I would get them and I plugged one in and hives appeared, and it was a stronger smelling one, so I had to hurry up and unplug it and try to air everything out. But if I'm in a car where somebody has like one of those little air freshener trees hanging, I have to ask them to remove it because my eyes will burn. I can't really breathe. Um, it has gotten pretty bad over the years. I Previous to all of this, I would say in my mid 20s, I went through quite a few years where I was really interested in trying to live as like natural as possible. So I didn't have a lot of chemicals that I would clean with. I would use like vinegar or essential oils, and I was really into like eating clean and eating healthy. And I did that for a while and I felt okay. Like I felt better than I probably did before in my life. But I didn't stick with it, and I kind of went back to how like the products that I would get before that, like the Clorox, the Airwick air fresheners, um, those kinds of things. And all of a sudden, I started to just have these sort of reactions. So I um, was just really confused, and I tried to. So my doctor, my primary doctor, was the one who diagnosed me with POTS, or postural orthostatic tachycardia syndrome, and he was the one who caught on to that. And it was interesting to me because when I was researching more after I was told that that's probably what I had, that's when I started to connect the pieces with like the hypermobility and then also with mast cell. And I remember mentioning it to him and asking him, could I have mast cell alongside POTS, or maybe could I have mast cell instead of POTS? Like I'm having a lot of these symptoms, these concerns that I could have this instead of just dysautonomia. And he didn't seem to understand or to connect the dots. It wasn't like, it felt like he didn't really even know about the correlation or the connection between the two. And he just told me to take like a papaya enzyme or something, which I don't think that is good for a mast cell. So I did not take that. But I personally had to try to find an allergist myself. So my daughter has an allergist that she sees for her allergies, but as much as I would go alongside with her to appointments sometimes for myself, I really wanted one that was going to do like extensive workups in terms of like autoimmune things and things like that I might be dealing with as well, because I noticed I got sick easily, all of these other things. And so I was looking for something like that. I could not for years find anybody that would see me because of wait lists and all other kinds of reasons. So um, they didn't accept my insurance, whatever. And so I finally was able to be seen by a immunology and allergist specialist this year. And it was somewhere around June or July. And I went. It was like an hour away from where I'm living. So I had to go quite a ways, outside of my area to make it to this appointment. And I mean, I guess it wasn't like really far. It was like an hour away, but it was far for me because I'm tired, I guess. But she just, as soon as I walked in the door for the appointment, she was like, or as soon as she walked in the door, because I was sitting in the room, she was like, I read over your medical history, and before we even get started, can I diagnose you? And I was like, sure. I was kind of curious what she was going to say, but I kind of had a feeling what she was going to say. And she's like, you have mast cell activation disorder, and that's what I'm diagnosing you with. And I was like, okay, but there's this part of me that was really hesitant to, I think, accept that diagnosis because I was the one who came about it and discovered it and found it. And like, it took me so long to find somebody who could validate that or who would diagnose that, that it felt like, how could I have known that? Like, how could I have figured that out before, like, a medical professional did, and it took them that long to figure that out for me. So I was just having a hard time with it. She had initially prescribed me Zyrtec once a day at the highest dose, and then Pepsid twice a day, and a spray for my nose. I can't remember what it was called, like Astelin or something, for congestion. And so I asked about specific allergies because I was curious if I was allergic to strawberries, if I was allergic to arugula. And I wanted to know those things because I wanted to know what foods I might be sensitive to so that I avoid them and can replace them with something else. And she just didn't seem to think food allergy testing was even necessary for me. And said that that wasn't something that she was going to do. She did run a panel for like environmental allergies like mold, dust, pollen, things like that, which I was fine with, which is surprising to me because I sneeze nonstop in the spring and the fall and at random times. And she said just because it's not positive doesn't mean that I don't have a sensitivity to it. And she also ran labs for like a tryptase and a 24-hour urine collection for histamine. At that time, I really wasn't symptomatic and I didn't have tryptase. My tryptase was pretty normal, and my urine sample got messed up a little bit because there was a hole in the container that I was given, so it wasn't holding the amount that it was supposed to, and I had to find a different container to put it in. But for the most part, that looked okay too. And she said that that doesn't indicate whether or not I have mast cell disorder because I wasn't symptomatic. I wasn't in the middle of like one of my flare-ups. And she was going based off of how many systems were involved for me, like gastrointestinal, cognitive, or neurological, my skin issues like angioedema and hives. This past year, instead of just hives by my eyes, I have experienced angioedema, like especially under this eye for some reason. There's a whole patch that goes from like right here all the way alongside here, flushing where my cheeks will get really red. I also have angioedema that goes from like right around this area and right around this area often. And so she basically is looking at all of those symptoms, and then the cardiology part of it too, where like the heart rate and all of that. And she said, because of that, I am diagnosed with mast cell activation disorder. So I left that appointment. It took me a while to actually start the Zyrtec and the famotidine because I was concerned about side effects and, just how I didn't feel good as it was. But my symptoms got bad enough to the point where I was scared enough to take and to start the famotidine and the Zyrtec, so I did. And then shortly after that, I was continuing to have reactions to smells that were around, fragrances, to the point where I had to go to the emergency room to get like breathing treatments. And at that point, I was prescribed cromolyn sodium, which was back in like September, so quite a few months ago. And I will be starting that this week, and hopefully that helps me. But yeah, I have symptoms like tongue swelling, a lot of involvement with like my mouth and like my face, throat tightness, um, hives, itching, flushing, diarrhea, low blood pressure, heart racing. I get worried often that I will go anaphylactic at some point. So with mast cell activation, everybody has like a bucket of what they can tolerate in terms of histamine. And if you're a healthy person, the histamine really doesn't affect you very much. Um, you could have an overflowing histamine bucket and you might still be able to be fine. But in somebody with mast cell activation, different things that add to the bucket raise your histamine levels. And if your bucket gets to the point where it overflows, you could have serious consequences like anaphylaxis. And it's hard because it's not with like a food allergy. You can kind of pinpoint, okay, this is what I'm allergic to. I'm going to avoid that. But with mast cell activation disorder, you can't pinpoint something. And it's a matter of trying to keep your histamine bucket stable and low. And so the different things that might add histamine to your bucket are things like infections, like viral infections, getting sick, um, things like your menstrual cycle. For me, one of the worst times for me with my mast cell activation symptoms is right at ovulation for some reason. I can feel and I know when I ovulate. And so when those few days are around every single month, my throat feels like it's going to close. I have more swelling. It's horrible. It's absolutely horrible. So hormones can affect you. Environmental factors, like if you get stung by a bee, mosquito bites, anything like that. If you're in like a really moldy environment, a dusty environment, if you breathe in a lot of like smog outside or air pollution, if you have a lot of like air fresheners around you. I even get really sensitive to like certain body washes, the fragrance in them. I can't use them. Those kinds of things will raise the histamine levels. And then your diet. So if you're eating foods that will release histamine or trigger a histamine release or contain histamine themselves, that's going to raise your level. So, and it's very hard to manage this because what that looks like is if you make any sort of meat, chicken, turkey, anything like that, you need to make it fresh and then freeze it right away. Because if you make it and keep it in the refrigerator, every day that you keep it in there, it releases like, I don't know how much extra histamine. I think it's like double the amount of histamine, but it releases a lot of histamine. So you are just eating, histamine basically when you do that. Certain fruits and certain vegetables will release it, tomatoes, spinach, canned fish like tuna, um, foods that have like a lot of like really processed foods that have a lot of like food coloring in them. Um, those things will all add to your bucket to kind of overflow. Any sort of stress you might be under, emotional, mental, financial, anything like that, adds to your bucket. And temperature. So if it's really humid outside, or if you go outside and it's really cold, you can have histamine release there too. So it's very tricky and it's very hard to figure out, what's going on. So I wanted to share a little bit about my story, a little bit about my experience with it, what it looks like, what it feels like for me, and maybe it can be helpful to somebody else who's confused, trying to figure out what's going on with them. And um, I'm sure I'm forgetting a lot. I'm sure that I'm missing some really key points, but I am just going to keep it at this and maybe make other videos talking a little bit more about it. But I thought that I would make like 3 main videos, like how do you know if you have this condition or that condition, because I would have found that to be helpful when I was going through the process of figuring it all out and being diagnosed. So again, I hope that if you are struggling with any of these things, you try to advocate for yourself. I know it was really hard for me to do because I didn't want to feel like I was, bothering people, or I didn't want to feel like, I was asking for too much or something, but it's your health and nobody's going to care more about it than you, and you have to advocate for yourself so that you can be as healthy as you can be, and you deserve that, and the people around you deserve that. So I hope that, you know if you feel like you are struggling with these things, you try to um, keep at it until somebody somewhere listens. And it can take a long time. For me, it took years before I reached that point, but eventually it will happen. And so that is what I've learned so far. And yeah, I'm going to kind of document my journey with it all and see if it gets better with a change in my diet, and where it kind of goes from here. But as of now, in a nutshell, this has been my experience with mast cell activation disorder, and what to kind of look out for in terms of symptoms if you feel you might be experiencing this condition.